Okay, so this is what you really want to know now is, so what do we do? You know, whether you're vaccinating or not, you need to do this, because vaccinating alone, as I've shown you, is no guarantee to preventing tetanus. Wound care is number one of importance. Nutrition is always important. We outline in our book how when nutrition changed, the susceptibility to diseases and the mortality went down. And vitamin C is not only preventive, but can actually slow the toxin in its steps. There are many papers that talk about how proper wound care is the most important thing when it comes to preventing tetanus, that it will prevent it in the vast majority of tetanus-prone injuries, which are deep injuries, injuries that involve necrosis or death of tissue, and that are dirty wounds. Those are the ones that are most likely to develop tetanus. This doctor here said he studied the epidemiology of tetanus in 1900 to 1969, and he says that the improvement in wound care had more of an effect than immunization, or may have had more of an effect than immunization in lowering the death rate over the past 70 years. So the first thing people want to do when there's a wound is to stop the bleeding, but unless you have severed an artery, you don't stop the bleeding. I cut my thumb a few weeks ago, and I stood over the sink and just let it bleed for about a minute, because you want to flush from inside to outside. You want your immune cells to be going through, and it's a way to cleanse the wound. And so you want to bleed first. Then you want any kind of foreign body, dirt, splinters, thoroughly removed. If you have a deep splinter, you have to cut into the skin to remove it, because people often leave the tip of the splinter in. You've got to get the whole thing out, open it up, and let it heal from inside out. And then you want to gently flush the wound with water or salt water, never using pressure. What I recommend is taking either salt water or sodium ascorbate and mixing 3 parts water to 1 part either salt or sodium ascorbate, and continuing to clean that wound. And when it comes to treating skin, I have found that the higher concentrations of colloidal silver are more effective. And so I recommend a 200 to 500 part per million for skin disease. Maybe not the same when it comes to taking it internally, but on skin I find this to be true. And so you can get this from iherb.com, this concentration. In your country, you can get lower concentrations. You can get a 10 part per million here in Sweden. Parts per million.
Yeah, but what does that mean?
It means how many particles of silver are in, yeah. And then you keep watching, because if you see something isn't going, yes?
What about hydrogen peroxide?
Well, okay. Hydrogen peroxide is very good at sterilizing wounds. The problem with hydrogen peroxide, you have to be careful, is if it is a tetanus-prone injury, it can kill cells. And tetanus likes to live in dead tissue. So if it's just a graze on the skin, fine. But if you have a deep wound, I'd rather not see hydrogen peroxide, because you can continue killing cells and it can be a problem. Okay, so always monitor the wound. If you see it getting worse, get to the doctor. If you can't get all the dirt or the particles out, get to the doctor. If you have any doubt, get to a doctor. I prefer not to use stitches. I was taught to use stitches just like that. But anymore, I'll usually, on a wound like this, I'll either do this with just these steri strips, or I'll maybe just put 2 or 3 stitches in and then steri strips, because stitches seal it up. And if you have anything caught in there, you can have a problem. And you don't get as good a cosmetic result with these stitches. You get like Frankenstein scar, unless you have a plastic surgeon that does it for you. You get beautiful result with this. I've treated many chin wounds and injuries, all kinds of skin injuries, just by cleaning, removing dead tissue, and gently taping. And then you can continue with antibacterial applications, colloidal silver, or sodium ascorbate. I want to tell you I'm almost done. I want to tell you 2 studies of using vitamin C in tetanus. This one was done in rats. And what they did is they had 5 groups of rats. And they gave them all twice the minimum lethal dose of tetanus toxin. And then they did different things here and looked at the outcome. Okay, so here they gave no vitamin C and all the rats died. Here they gave vitamin C, they developed mild tetanus and they all survived. Here they gave the toxin after giving vitamin C and they gave vitamin C ongoing. They developed no symptoms and they all survived. Now this is the group I recommend we all stay in as humans, because after you have a wound, you are potentially this group where you can take vitamin C right away before any toxin is produced. Okay, so you can be this group that has no symptoms and all survive. This one here, they gave higher dose intraperitoneally after symptoms developed. It stopped the symptoms from spreading and they all survived. This one had higher doses after symptoms developed. They all survived. So we can see here that vitamin C has an effect upon the disease and can, because it's a toxin neutralizer as well as many other things vitamin C does, that it's a very something that the immune system needs to function properly, and it neutralizes toxins directly. Well, you might say, well, that was just in rats. Who cares about rats? But we have a study in humans from Bangladesh, where usually the death rate is very high from tetanus. And they gave 117 humans that developed tetanus in Bangladesh, and they gave all of them conventional treatment. But half of them they treated with vitamin C. They gave, no matter if you were a baby or you were 70 kilograms, you got 1,000 milligrams of vitamin C. And this is the result. Here we have age 1 through 12, the vitamin C group. 31 of these patients, they all recovered, nobody died. Here we have no vitamin C, 31 patients, 74% of them died. Okay, let's look at the 13 to 30-year-old group. 27, 17 recovered, 37% died. No vitamin C, 67.8% died. Why? Because they didn't dose on milligram per kilogram. Had they dosed according to weight, I believe that this rate would have been 0 or close to 0. That's how it should be. I would have given these adults maybe 100 grams instead of 1 gram. But you can see even 1 gram, the mortality rate was 0 in these people. So now you're informed. Now you can be making your decisions from an informed place. You know a little bit more about wound management. You know a lot more about aluminium. And I can talk a little bit about autism if you'd like me to.
Could I just have one final question about the vitamin C? What kind of vitamin C do you recommend?
Okay. I use this brand because it is inexpensive and highly effective. And people say to me, well, why not natural? Why not natural? And I say, well, because the concentration of ascorbate in this is 100 times more than natural. And when you have a toxin-producing disease, you need high doses. And then we have this lipospheric, which is nice because you can mix it into drinks, you can swab it inside the mouth, you can rub it onto the skin, it's a gel. And I recommend that everybody has both of these in their house, always, because whether you have whooping cough, or a bad wound, or influenza, or diarrhea, this is what your immune system needs. If you have a wound, it's what your skin needs. If you have a bone fracture, you can't heal bone without vitamin C. If you have chronic fatigue and adrenal shutdown, you can't make neurotransmitters. Your adrenal glands use a lot of vitamin C, so you need to have this for many different things. Now, I'm not saying don't eat lots of produce that has vitamin C. Always, always eat lots of produce that has vitamin C, but you're not going to get the levels that you can get from even a teaspoonful of this. You get 5,000 milligrams of L-ascorbate. With natural forms, you can get around 250 to 500 milligrams if you're lucky. with camu or rose hips or acerola. And with food, you get, say, in a, what do you call them? You call them paprika. You can get 300 milligrams in one paprika. So we all just got a little bit outside eating slices. And you get the natural form, which is good because it has flavones, which preserves the vitamin C. And so that's good. But you would have to eat a room full of paprika to get what you get in this bottle here. Okay? And if it can prevent you from taking antibiotics or ending up in intensive care unit, I don't care that it's synthetic. It's keeping me out of intensive care unit. And oranges won't do that.